My name is State Representative Yolly Roberson. I represent District 104. My district is one of the most diverse districts in the state of Florida. We have a large number of African American, Haitian American, Trinidadian, Anglo, Hispanic. It's really a privilege to represent such a diverse district. I have been in the Florida House for now 7 years, and getting to know the people in my district has been a real joy and a real privilege. I was born in Haiti. I like to think of myself as a black woman who was born in the shores of Haiti. I came into the United States with my grandmother in the 70s, and I live in Boston. I went to high school in Boston. I went to the University of Massachusetts and earned my bachelor's degree in nursing. I worked as a nurse for some time at Boston City Hospital, Brigham Hospital, several hospitals in Boston, Massachusetts. And then I went to law school. I worked full-time as a nurse while I went full-time to law school. I graduated from law school from New England School of Law in 1987. I have been a lawyer since 1987. I have worked as a public defender. I have worked as a prosecutor. I have worked as an immigration attorney, family law attorney, real estate. I've done real estate closing. I've done real estate litigation, and I've done dependency. I have devoted my entire life to public service. Some people say that I got that from my grandfather. My grandfather was a congressperson in Haiti. My father was a judge and was also a mayor. My grandmother, who raised me when my mother died when I was 2 years old. My grandmother raised me. She died 2 years ago at the age of 103. Yes, and she died in Boston. She's the most influential person in my life. She taught me how to be whatever I wanted to be very early in life. She instilled in us the desire to serve and also a sense of self. She taught us that we could be, regardless of where we were, whether we were in Haiti, in America, that we could be whoever we wanted to be. And in addition, we were here for a purpose. We were not an island. We were here to help other people. So I have done that as a nurse. As a registered nurse, I've worked as mental health nurse, I've worked as ICU nurse, CCU nurse, and as a public defender, I've represented all ethnic groups. So I am so privileged. I feel so privileged and so honored that I was chosen to serve the people, not just the people of my district, but the people of the state of Florida. And I'm looking forward. Unfortunately, my term is over. This is my 4th term in the Florida House. But I'm looking forward to serving the people of the state of Florida at any capacity, at any level. I'm ready, I'm prepared, and I love serving the people of the state of Florida. I am assigned to about 7 committees. Human Services Appropriation, I am the Democratic ranking member in that committee. I am also assigned to Criminal and Civil Justice Council, full appropriation on general health care, policy, rules and calendar, and Seminole Select Committee on Seminole on the gambling. We have a challenge this year because when I was assigned to Human Services Appropriation, I figured, why do I have to be in that committee? Because I did not ask for it. But I'm so glad that I was assigned there, because with my background as a nurse and the community that I serve, I needed to be there, because we have a chance this year to look at the budget line by line. Because of the tough year that we're dealing with, this is the time for us to reevaluate the way we've been serving our community, the way we've been using the tax dollars, the way services have been delivered. This is an opportunity for us to reorganize the healthcare, to reprioritize, and I'm working very hard to make sure that going forward, we always protect the least fortunate, and we're going to continue to do that this year and the year to come. This is a bill that I filed 2 years ago. And simply that what this bill seeks to do is to increase the number of ethnic minorities in the healthcare profession. As a woman who is also a nurse and speak different languages, I know how helpful it is to be sensitive to other people's culture, regardless. And ethnic and racial diversity doesn't have to do with only my Black or Hispanic. It has to do with people of different culture, wherever they may be. I mean, whether they're from England, whether they're from Ireland, whether they're from Africa or Russia or Haiti. We need to be sensitive to other people's culture in the healthcare delivery. And that makes a very big difference. That makes a difference even in the cost of healthcare. Sometimes people don't think that, but when the person doesn't understand the instruction that you're giving the patient, that could make the difference between sometime a longer treatment or even death. This bill is entitled the Headers Bill because this young kid was killed because someone while driving was talking on the phone and did not pay attention and hit and kill that young woman. So I hope to pass this bill in memory of Heather. All this bill proposes to do is to prevent people from talking on the phone while driving. We have the use of headset. They can use headset, but not using the telephone while they're driving. And that is very, very important. This is another good bill because we have a very high incidence of melanoma. And skin cancer is something that young people, teenagers especially, they don't think about when they're 16 or younger. And this is why I filed this bill to make sure that if a young child is going to go in those tanning booths, they need to have their parents' consent. Their parents need to be aware of the risk involved, and so that child can be protected. It's been such a tough, enjoyable, exhilarating, an experience that I cannot even find a word to describe. Being in the Florida House has given me the opportunity to give a voice to people who did not have a voice, who could not have dreamed of having a voice. When I see myself to date in the Florida House, it's just like I'm at awe to see that Yolly Roberson, a Black woman from Haiti, is making law, making policy, protecting the less fortunate, and protecting everyone. As far as healthcare is concerned, education, prevention, it's just been an incredible ride. And I thank the people of my district, I thank the people of Florida, and particularly the people of my district, those who come and volunteer and voted for me. I thank them for having sent me to Tallahassee to serve them. I did not have any intention to run for office because I was a small community lawyer doing my community service in my community. But when I looked around and see issues that were not being addressed, healthcare issues, women issues, children issues, and I talked to several legislators and other people, and nothing was being done. And I decided then it was time for me to run. And that was the best motivation I had. And I ran in 2002, the first time for the State House District 104, and I won, and I've been serving since then.